parents have been advised to bring their children for proper diagnosis and get them the right medicals if they want to control childhood asthma. This advice was given by consultant respiratory physician at an asthma talk with teachers organized by Acacia Nigeria and the Lagos State University Teaching Hospital, LASUTH. Justin Adeyeye tells us more.
World Health Organization (WHO) estimates that more than 100 million people could suffer from asthma in Nigeria by 2025. Yet Africa's biggest economy has only one qualified respiratory physician for every 2 million people. Worried about achieving control of asthma in children in Africa, and with studies showing that over 10 million Nigerians have asthma, the role of the teachers once again takes center stage. Consultant respiratory physician at the Lagos State University Teaching Hospital, Dr. Olufunke Adeyeye, and other doctors alike say teachers need to do more as they spend more time with the children.
So it's important that the teachers know about asthma and know, how to support them. Okay, we've actually done a study before that looked at the knowledge of the teachers about asthma here in Lagos State, and we found out that many teachers do not know much about asthma. And we also felt that this would be an intervention that we also push the information out there into the space for the teachers so that they can be of help. The teachers are not going to do anything new. It's just part of what is happening elsewhere in the world. That because the children are young, they're in school, most of them are in school, and they spend a long time in school. So school environments have triggers.
For teachers to be able to know how to recognize the symptoms of asthma, to be able to recognize pupils with crisis of asthma, and of course to know what exactly to do when those children have attacks in their various schools.
Say that every parent that has asthma, automatically their children will have asthma, but it does increase the predisposition to asthma in those children. So that's the role of genetics or inheritance. So it's not absolute, but it does make contribution. Care of children with asthma is there's this misunderstanding, myths around asthma. For example, some people regard it as being that it could be transmitted as an infection, or that use of some of these control devices, the treatment devices, are addictive. So we need to get rid of those myths. We need to empower them with the right knowledge. So if they find themselves having some of their pupils with asthma, they are able to provide a positive environment.
These teachers and caregivers say they are most often oblivious of what to do when some children present with asthma symptoms. They also speak of inadequate first aid medications for asthmatic patients.
I know that if I sit in a child, in a learner, I know what to do now. And then that gives me the room to prepare for likely things the child will need, even before he runs into emergency. So it makes us better on top of our job. We're able to do our job better, and then there is peace that even if a child runs into a crisis, you know what to do before the child is taken to the hospital.
I will inform the teachers about what we have learned here today. Then we will call the parents forum to inform them that any child that is having asthma, they should be able to tell us in the school so that we will know beforehand. If anything should happen, we'll be able to take precautions on whatever we have learned here today.
World Asthma Day takes place on the first Tuesday of May. The event is annually organized on an international level by the Global Initiative for Asthma, GINA, to create a better understanding of the respiratory disease. The theme for World Asthma Day 2019 is Stop for Asthma. Justin Adeyeye, Galaxy News, Lagos.
Now, away from that, the federal government has been employed by